ambiguous and difficult to define exactly. We talked to professionals across Hopkins to get their perspective on what the business of health means to them.
The business of health is a topic close and dear to my heart. I'm a business school professor, and also I have a joint appointment at School Public Health. Fundamental, I think business of health deals with two extremely important uh, things in life. Number one, it's money, right? Money is universally exchangeable. You can use that by almost everything, but not health in some cases. So health gives us time, right? Time is extremely valuable. So this is a combination of money and time. Nothing's more mysterious and more powerful than these two elements. So that's why I really love this topic, and it's close dear to my heart.
Great. To me, business of health is sort of the recognition that that there are businesses and private enterprises in health and healthcare in the United States, and it's kind of fundamental to the way our system operates or doesn't, and that there's opportunity in that. I think in some cases it creates some positive incentives and good things happen, but also where there's failures, which is common in healthcare, there's opportunities also because we, to some extent, through economics and other social sciences and other fields, we kind of know things about how businesses operate and how they respond to incentives, and we can sort of modify the environment to hopefully get better outcomes.
Other thing I think of when I think of business of health is the other direction. I think of that health needs to be infused with all aspects of business. Every business has health implications. Most people in this country receive their health insurance from their employer. We spend a lot of time at work, so a lot of our wellness and health derives from the things we do at work. And a lot of businesses have a health impact outside of just their own employees, right?
What business of health means to me is sustainability, creating models that ensure each idea we have of health can fund itself and continue running even when it's most needed.
As you can see, there are various definitions for what the business of health means, and it represents the growing challenges for both the healthcare and the business world. What are some ways that we can find common ground?
In order to incorporate sustainability as an important framework of the business of health, we need to consider different elements. The first that comes to mind is actually bringing together all the stakeholders to the table. This could include the community themselves, and in this case, in my case, I'm speaking about the caregiving community. They have the lived experiences, they know best how to speak about their needs and also how to address them. So having them at the table is a very, very important element. Other policymakers, corporations as well, just involving them in different ways is fundamental.
Yeah, and I think that when we speak about interactions with business more broadly, there's more opportunities, I think, for the the research community to interact more with the business community on these issues of health because they're important from the standpoint of public health. They're important from the standpoint of well-functioning markets when it comes to economics, and they're important for the business's own profit margins, right? Businesses, as I said before, pay for their employees' insurance. So the incentives are aligned here for more collaboration and more innovation. I think it just takes people willing to engage in it and actually do it and get these things off the ground. They're tough to do, but that doesn't mean we should shy away from it. And I think that's one of the reasons HBHI is so great at bringing those things together.
The second thing, how can we improve? I think the most important thing is to align incentives. There are so many players in this huge system. If, let's say, we make sure that the providers get financial benefit if they're doing the right thing for patients, right? And the patients get a financial benefit if they're doing the right thing for their health, then this will save a lot of money and improve the quality of care on almost every dimension.
The key to bridging the gap between business and healthcare is collaboration. Our panelists have highlighted the power of collaboration across disciplines as the future of the business of health. HBHI hopes to see a healthier America supported by an affordable and equitable, high-value health system. HBHI uses both collaborative research and breaks down traditional academic silos to create sustainable collaboration to eventually lead to impactful, scalable, and sustainable solutions.